way we can go back to our normal lifestyle, or should we live with this diabetes forever?
Okay, very important question. uh, because the buzzword diabetic reversal, many companies they are promoting we are reversing diabetes, but there is a difference. Diabetes reversal means you are off the drugs, you don't need any tablets, and you are off the drugs for your lifetime. But that doesn't happen actually, and the right term should be like diabetes remission. That is, you are off the drug at least 3 months. That's the definition of diabetes remission. Of the drugs or of the insulin, only with your lifestyle modification you maintain the normal blood sugar below HbA1c below 6.5, fasting below 100, pp below 200, without any drugs for the at least for 3 months. Then you can tell that you are into remission. Okay, and the question is like how to do that, or how to have that. Okay, so very importantly, as I said, we have more of fat mass, less of muscles. Now the term I said in the beginning, that's the insulin resistance. Now with more fat, less muscle, the insulin resistance grows up. And if we reverse that, if we reduce the fat mass basically in the abdominal area, and we improve the muscle mass by any means, by exercising, by any means, okay, then we are going to keep it in remission. The second most important, and mostly people think that more than diet, the exercise part is having more weightage in terms of the diabetes control or diabetes reversal. But the truth is, our diet is responsible for more than 70% contributing towards the increased blood sugar, while exercise only contributes to less than 30%. Okay, so how the diet has changed? If we look into the ages like Stone Age, when we lived in the cages, now what we used to eat? We used to eat raw meat, or burnt meat. That's what we are eating, and what it is made of? It is made of fat and proteins. Now carbs only in the form of some vegetables, raw vegetables or fruits, we were consuming fat. Now you come back to this area, what we are consuming, mostly our Indian diet or any local diet, you check, it is mostly the carbohydrates, and the most importantly refined carbohydrates. Those are very harmful. Okay, and secondly, we are lacking in protein. We must take like 1 gram per kg body weight protein, and that too complete proteins daily, in order to maintain the hormonal system, the whole body repair mechanism, wear and tear mechanism. Now we are taking less than 10 grams per day, and that too incomplete proteins. And by proteins we mean like no non-veg or animal proteins, because they are the complete proteins. But again, there is another risk. There is a lot of adulteration, while making a chicken, meat or mutton. What we are using, all pesticides, chemicals, steroids and antibiotics, a lot. In 28 days, one report says that the chicken to grow, they inject 28 injections daily, one injection. So what to do? So the theme is, we should balance our intake of carbohydrate, should reduce. And why do we need carbs? We need carbs in order to have the energy we want for the daily expenditure. So if we take more, then it is going to cause harm. It will be stored in our body as glycogen or fat, then mostly in the liver and the abdominal area, and that is going to harm us by reducing the insulin sensitivity. And because of less protein intake, the muscle mass also is getting less. And because of the disuse atrophy, that is because we are not moving too much, most of us do the sitting job, so again the muscle mass is reducing. So this holds the mantra, that is in reducing the consumption of carbs, reducing the fat mass inside the body, and improving the muscle mass is the key.